Most men over 40 secretly wonder the same thing. Am I normal? But few ever ask. In clinic rooms across the world, behind the polite nods and nervous smiles, I've seen the same quiet fear reflected in countless eyes. The truth is, misconceptions about penis size don't just bruise confidence, they shape relationships, intimacy, and even mental health. I'm Dr. Vera Sterling, a urologist who spent over 20 years studying men's health, and today I'm going to tell you exactly what normal really means and why understanding your body is far more powerful than chasing numbers. Understanding the reality behind the numbers. I still remember the first time a patient asked me, voice trembling, "Doctor, is it too small?" He wasn't the first, and he won't be the last. In urology, this question is more common than people realize, yet it's rarely answered with the clarity or compassion it deserves. Society has filled men's minds with exaggerated standards, fueled by media myths and locker room comparisons. But when we look at the science, the truth is simple and often surprising. The average erect penis length across numerous studies falls between 12.9 and 13.9 centimeters. That's roughly 5 to 5.5 inches. When flaccid, it typically measures around 9 centimeters, or about 3.5 inches. The average girth when erect is close to 11.6 centimeters, or 4.6 inches. These numbers are not random. They come from thousands of measured cases in peer-reviewed clinical research. And here's what matters most. The range of normal is broad. Just as men differ in height or shoulder width, penile size varies naturally. Nearly 95% of men fall within that range. Only a very small percentage, less than 2%, have what's considered micropenis, which is an erect length of less than 7 centimeters. But the problem is not the numbers, it's perception. Men often overestimate what's average and underestimate themselves. Many think that 6.5 or 7 inches is the standard, when in truth, those sizes are well above average. This false belief drives anxiety, avoidance of intimacy, and unnecessary shame. As a urologist, I see the damage this causes, not just in the bedroom, but in self-worth. The body reacts to insecurity the same way it reacts to threat, with stress hormones, tension, and physical withdrawal. Confidence, on the other hand, has a measurable effect on performance. The mind and body are deeply connected, especially in sexual health. So how do we measure accurately without confusion or comparison anxiety? Here's how I guide my patients to do it properly. Length measurement. Use a ruler or tape measure. Place it at the pubic bone, pressing gently through the fat pad, and measure to the tip of the glands along the top side. Do this when fully erect. Measuring from the surface of the skin alone gives a shorter, less accurate result. Girth measurement. Use a flexible measuring tape or string. Wrap it gently around the thickest part of the shaft when erect, then check the length of the string if that's easier to handle. Measurements should be done in a comfortable, private setting without pressure or judgment. Remember, the penis has natural variability depending on temperature, stress, and time of day. Even hydration levels and arousal patterns can affect measurement by a small margin. But what I always tell my patients is this: numbers alone don't define masculinity or satisfaction. Partners don't measure love, connection, or presence in centimeters. They feel it in confidence, communication, and comfort. The average size is not something to fear, it's something to embrace. And yet, many men still believe they must fix themselves. They turn to pills, pumps, and unregulated treatments that promise miracles but deliver only risk. That's where the conversation must go deeper into anatomy, perception, and evidence-based care. Because understanding your body isn't just about length, it's about health. In the next part, I'll reveal how your penis size relates to function, the hidden factors that make men think they're smaller than they are, and the truth about enhancement procedures from a urologist who's seen it all. The hidden truth about size, perception, and health. When I talk to men in my clinic about penis size, the question is rarely about anatomy. It's about acceptance. I'm Dr. Vera Sterling, and after decades as a urologist, I've learned that most men aren't looking for a measurement. They're searching for reassurance. They want to know if they're normal, if they're adequate, and if what they have is enough. And the answer, in nearly every case, is yes. Let's talk about what size really means in the context of health and confidence. The penis is not a bone. It's a vascular organ, a structure made of 3 main chambers of erectile tissue that fill with blood when aroused. Because of this, appearance changes constantly. Temperature, hydration, anxiety, and even posture can make a noticeable difference. That's why no 2 measurements ever look exactly the same. When you feel smaller on a cold morning or after stress, that's not your body failing you, it's simply physiology doing what it's meant to do. But many men misunderstand this, and they panic. They start believing something is wrong when it isn't. And once that fear takes hold, it spreads quickly into self-doubt, anxiety, and even avoidance of intimacy. The truth is, the mind controls the body far more than we admit. Performance issues, loss of erection, and premature ejaculation often have less to do with anatomy and far more to do with confidence. When a man feels uncertain about himself, his body mirrors that insecurity. His heartbeat changes, blood flow shifts, and the erection softens, not because he's incapable, but because he's afraid. That's why I always tell my patients, understanding your size is not just about measurement, it's about freeing yourself from comparison. And when we talk about health, there are deeper layers. Erectile tissue health depends on good circulation. Anything that damages blood vessels, high blood pressure, diabetes, smoking, obesity, will eventually affect erection quality. Improving these factors can make a visible, measurable difference in appearance and function. Many men who start exercising, eating better, and managing stress report firmer, fuller erections, not because the organ itself grew, but because blood flow improved dramatically. So yes, you can make a difference. But it doesn't come from pills, pumps, or unproven miracle treatments. It comes from the same habits that protect your heart, brain, and body: movement, balanced nutrition, and stress control. I often meet men who are desperate for quick fixes. They bring me internet products or talk about injections and surgeries they've read about online. Procedures like ligament release or fat transfer might increase visible length slightly, but they come with significant risks: scarring, loss of sensation, or erectile dysfunction. Some men gain a centimeter and lose their confidence forever. And here's the heartbreaking part: almost none of them needed surgery in the first place. When I show them the data, when I measure them clinically, they discover they were completely average all along. The problem was never their body. It was the unrealistic lens through which they saw it. And what about satisfaction? Let's be clear, sexual pleasure isn't a competition of centimeters. The average vaginal depth is 3 to 4 inches, and it adapts during arousal. Beyond that, emotional connection, rhythm, and trust determine fulfillment. Studies consistently show that communication and comfort outweigh size when it comes to intimacy. So when you focus on emotional connection and body awareness, you automatically improve your experience and your partner's. Sometimes I remind my patients that penis size is like height. You didn't choose it, and it doesn't define your worth. What you can control is how you treat your body and how you see yourself. Every organ in your body depends on blood flow, oxygen, and calmness. The penis is no different. A healthy lifestyle doesn't just protect your heart, it strengthens your confidence. And confidence, unlike anatomy, is entirely within your power. After 20 years in urology, I can tell you this truth without hesitation. The most fulfilled men aren't the ones with the largest measurements. They're the ones who understand their bodies, accept them, and live with gratitude instead of comparison. You've been lied to by culture, by media, and sometimes by your own self-doubt. The real average penis size is far less important than the real average misunderstanding about what it means to be a man. You are normal. You are capable. You are enough. Take care of your body, nurture your health, and never let a number decide your confidence. Dr. Vera Sterling, urologist and men's health specialist.